Welcome back to the TRM show. I am your host, Dave Serafinas. Today's guest is a healthcare economist and published author who focuses on working with companies. His specialty as a consultant is using quantitative techniques to examine issues concerning healthcare technology, quality, and operations. His peer-reviewed research has focused on improving healthcare quality in mHealth or mobile health and high-cost areas of medicine. Dr. Adam Powell holds a doctorate and master's degree from the Wharton School of the University of Pennsylvania, where he studied healthcare management and economics. He also holds a bachelor's degree in management science and writing from the Massachusetts Institute of Technology. More importantly, Adam is the president of Payer Provider Syndicate, a managed advisory and operational consultancy firm focused on the managed care and healthcare delivery industries. Due to his interest in mental health apps, he is on the scientific advisory board of CyberGuide and a co-founder of the Society for Digital Mental Health. He is known for his expertise in global health informatics and has lectured extensively in Asia. He's a member of the adjunct faculties of Northeastern University and Thomas Jefferson University, where he teaches master's courses on health economics, healthcare supply chain operations, epidemiology, and global health informatics. Welcome to the show, Dr. Powell. I'm glad you can make it.
Thanks for inviting me.
Yeah. So you and I first met doing a project together a while ago for a great big company, and I knew about you. I had heard about you, and I knew you from my area, my neck of the woods, and had a lot of fun working with you. You certainly had a lot to offer. And like I said, I'm glad you're on the show. I think you'll give a lot of good information to our viewers.
It was quite an interesting project. We got to help a multinational company. And some of the things that we learned will actually be the topic of this episode.
How can an organization keep abreast of emerging diseases and medical risks that could potentially impact travelers?
So this became a real big issue during the COVID pandemic, as there was a need to travel to places in different prevalences of COVID in different areas. But it's actually been an issue for a much longer time than that. While this has become more top of mind recently, organizations have been concerned about this for decades. And as a result, there's a whole ecosystem of resources that exist that can help organizations understand where there are potential medical risks, whether those medical risks may matter to their employees, and what they might be able to do to mitigate them. So people often don't like to spend money on things, especially consumers that don't necessarily have a corporate budget. So some free places to start out would be One Health Map, which is a map that shows where new cases of disease are located and then provides some insights into what articles are behind those cases of disease. And then beyond that, there's a site called ProMed, which has email alerts about new outbreaks, and these are likewise also plotted on the map. And ProMed is special because it's run by the International Society for Infectious Diseases. So these are two simple solutions that individuals can use on their own, but corporations that are looking for perhaps a more robust solution may wish to spend some money. And so there's companies like Blue Dot, which uses private and public data and flight schedules to triage biothreats. And then there's also GeoSentinel, which is a site run by the International Society of Travel Medicine, which detects and reports on disease trends so that employers can keep up to date and protect their personnel.
You know, I'm familiar with some of those sites that you pointed out, and they're really good sources of information. What issues do organizations need to consider when reviewing data about emerging diseases in some countries?
So while there may be threats, they may not actually be threats that change our decision making. So for instance, I'm a Chicagoan, as my accent may pretend. I'm originally in Chicago and I now live in Boston. And if you ask a person, is Chicago safe? I mentioned Chicago because it does have a bit of a gun violence problem. And then we can look at other countries and look at, for instance, their safety, both medical and security. And we can ask ourselves, well, yeah, there's a problem, but is that problem going to change our decisions? And one of the things I've often joked with my family is, well, is it safer or more dangerous than Chicago? And so one of the questions is the threat a threat that will either change your decision to take a trip or change the precautions that you take during the trip. Because the world and life is full of threats, but we just have to decide which of them are going to impact our decision making. And we also have to decide if that threat is geographically or temporally confined. So we may read that there's, dangers of dengue in China. Well, China is a huge country. Are we talking about Yunnan? Are we talking about Shanghai? Sometimes this country-specific threat information can be pretty useless in that the nation is so diverse. Why should something that's happening in Florida impact our trip to Idaho? And then also, is the threat something that's temporarily nearby? Is this a disease outbreak that happened 3 years ago? Is it something that happened last week? How near to our trip is this both geographically and temporally? And even if we're deciding that we don't want to go to a particular place, an organization cannot necessarily fully shield itself from a threat. It has to think about how might this issue impact vendors, the supply chain, or even the customers of the organization, because there may be various actors that interact with the organization that can't be removed from that location and nonetheless could impact the organization.
Dr. Powell, I think I'm going to have you back on the show because you could probably give us, 20 more hours of this stuff. In fact, if you're okay with it, I'd love to have you back on the show. Can't wait to post this. And once again, thank you so much for being on the show. And hopefully we'll talk soon.
Likewise. It's always a pleasure. Good to hear from you again. Thank you for inviting me on.
Sure.